Testing, testing. 1, 2, kitten. Oh no, I turned it sideways. I don't know if this is going to pick up my wonderful face. I have no idea how many hours of sleep I had. It's less than 5. It probably fits on one finger. Because National Geographic was on and then infomercials came on. So that's like 5 o'clock in the morning. And I remember the infomercials. So, 2 or 3 hours, I think, last night. I went to Yale, New Haven, the magical mansion of malpractice magicians. And what did I get from there? Oh, let's see. The dog just scattered everything to the 4 winds. Let's go over here and pick it. Oh, I just totally there's a word I want to use that I shouldn't. My finger got in front of here like this. See? The face, finger, face, finger. It's like a neurological exam that they do at the hospital. Pretty good, actually. I'm doing well. I got some parting gifts. I got this discharge summary. And do you know what it says on the report? The MRI report? Check this out. They got 20% of it right. Which means they didn't find 80% of it. Which for them is pretty damn good. I mean, for a hospital, it's fucking atrocious and terrible. And I have no idea why they even have a radiology department. They could just have like some witch doctor throwing bones in a hallway. It would be a lot cheaper than all those MRIs. Probably far more effective at discovery. Let's read what we got here. MRI total spine without IV contrast performed. Polytrauma, critical, TL spine injury suspected. Holy crap, suspected? If you aren't fucking absolutely certain, you got your head way up your ass. So far, you're talking out of your mouth. And there's probably shit stains on your teeth and face because it went all the way through your poop hole, stomach, maybe some acid. Suspected? No, not suspected. Overwhelmingly documented? What the fuck's wrong with this guy's spine? That's a little more accurate. Suspected? No. Polytrauma? That means a lot of trauma. Yeah. PTSD from this bullshit? Here? Yeah. That kind of polytrauma. Technique. A witch doctor threw bones in a corner and then we writ some shit down on some paper after not looking at the films. No, that's not what they said. But that would have been way more effective. There is normal anatomic alignment of the spine. No, there isn't. It's a straight fucking line. It's got kyphosis of 35 degrees in my cervical spine. What the fuck's wrong with you? Jesus Christ. Performed after the administration of 19 Cs of doterum intravenously. Doterum, that's not gadolinium. That's probably why my arm isn't all swollen up. Oh, I got some surprises there for you later. Normal anatomic alignment of the spine. Normal if like children were playing Jenga and they took a bunch of vertebrae and stacked them on top of each other in a straight line. That's not normal anatomic alignment at all. There's kyphosis, stenosis, every other osis in the book. Kyphosis, lordosis, stenosis, scoliosis, you fucking name it. That thing's a weird, snaky type of thing. Mild chronic wedge compression fracture along the superior end plate of the T9 vertebral body is unchanged without associated edema. That means that the first time in history a radiologist at Yale actually found the fracture in my spine that they said I totally did not have and needed to go home without any type of bracing or support in 2015 when my son jumped in the bed, did a cannonball in the air, landed on my chest, and snapped my spine in half. This is the first report. It's 2019, February, where they actually found the fucking fracture. First fucking time. At all. So I guess when I go to sue Yale, I'm going to have to get whatever fucking moron did this report to testify against the other moron that did the report that said there was nothing wrong with my back and sent me home with a broken spine. That's happened 20 times, maybe? I'm not exaggerating, like probably that many times. What else we got? No edema means that it's healed. There's also chronic mild wedging of the T2 superior end plate. That means the top part of it. The remaining vertebral body heights are maintained without evidence of acute fracture of thesis. Let me tell you something about acute fracture in my spine. Every single one of my goddamn vertebrae on a, what the fuck do you call it? CT scan, not MRI. You're not going to see it on an MRI. MRI is used for imaging soft tissue. It's not used for imaging bone. Soft tissue gets in the way and you can't see the bone, which is why you do a CT scan, which is why I asked them to do a CT scan, because I was mostly concerned about broken bones. Every single one of my vertebrae has at least one. Almost all have 3 to 4 stress and compression fractures, and many of them have been completely crushed. So that's bullshit. He found one fracture that healed. Disc desiccation to L4 and L5 and L5. Really? You found disc desiccation to L4, L5 and L5S1 where I don't have any discs? It's a solid piece of bone because it's self-fused? You found disc desiccation where there's no discs. Explain that one to me, genius. Significant loss of disc space height at L5S1. No, there's no goddamn disc. And there isn't a loss of height because the bones grew themselves together and knitted, and that's how I went from being 6'5" to 6'2.5" to now 6'6", because my spine's growing together into a solid piece of bone. The remaining vertebral and without evidence of acute fracture. Okay, an acute fracture, that could mean something that was just broken. So he might be saying that there's no new fractures. Acute means an onset that's rapid and certain and now. So, okay, maybe I misread at that. But there's sure a whole hell of a lot of fractures in there that were never found when they actually happened. I wouldn't be surprised if there's one in there from the car accident I had the day before yesterday now, because I've been in there overnight in Torrington when I looked at a house and my car slid off an ice-laden driveway into a retaining wall and set off the airbag. So there's a good possibility my back's broken right now. And they didn't find it, and they won't until it's healed because they didn't do a CT scan, which is the only way you're going to find fucking fractures on someone with Ehlers-Danlos syndrome. Disc desiccation, Jesus Christ. So L4, L5, they're saying that there's a loss of disc space height at L5S1. No, there's no goddamn disc whatsoever, and the bones are knitting themselves together. And actually, it's increased in height, which pulls on my cord and tugs my brain out of my skull, similar to the prior exam. So he looked at old exams, and he's still saying this bullshit. That's ridiculous. No significant interval changes in scattered foci of the T2 prolongation within the spinal cord, the most pronounced as follows. There are significant interval changes. You don't know what that means, and I'm too fucking exhausted to try and explain it right now because it would take about an hour. It means you're all fucked up. At C2 level in the right hemichord, we'll take a look at that. Series 5, image 12. We'll go look at that. I haven't looked at the series yet and seen how wrong they are. At C3, C4, and C4, C5 in the right hemichord. Patch, hazy, T2 hyperintensity. Patchy, hazy, T2 hyperintensity. That means with the T2 imaging technique, not thoracic, second thoracic vertebrae, but T2 is how they weight the MRI and the hyperintensity. It's patchy and hazy. That's a really good way to say, I don't know what the fuck's there. Usually they call it an artifact. Patchy, hazy, hard to image. That's I don't know what it is. And that's what a radiologist says when they can't identify a syrinx inside of a spinal cord, which is the tumor I have that runs the almost entire length of my spinal cord. As how many neurosurgeons have? 3 or 4? One of the best Ehlers-Danlos doctors in the world, Fraser Henderson, have all found and noted. So we're going to have to find out why this guy didn't see any syrinx that's in my entire spinal cord. At T4 level, in the ventral cord, they're just lifting where there are no significant interval changes. With the most pronounced. What the fuck? Is he saying there's no changes from old films? T2 prolongation, the most pronounced as follows. C2, C3, C3, C4, C4, C5. That's my whole fucking neck. You might as well just say, yeah, this whole neck's fucked. At T4 level, that is the thoracic, in the ventral cord. T7, T8 in the right hemichord. T10, T11 in the dorsal cord. Yeah, there is no definite association enhancement to suggest active demyelination. No new lesion is identified. I'll have to look at that. I haven't looked at the disc. I'm just reading this incredibly bad report and going off what I know is there and hasn't changed. Or it has changed and they've never found before, like the broken spine. That this is the first report Yale's ever mentioned anything about. Multiple degenerative disc change diseases are overall similar compared to the prior exam, except for a new small posterior annular fissure at L2, L3. An annular fissure means that the disc has ripped a hole in itself, which probably happened during the accident at L2, L3. Although that's going to be difficult to figure out because that's where my nerves are being pulled through the bone like a cheese slicer goes through soft mozzarella. Basically, I'll show you a picture of that later. There is no definite associated enhancement to suggest active demyelination. Multi-level genital disc disease. At C3, C4, there is right paracentral disc osteophyte complex. That means it's a bone spur at C3, C4. And bilateral, which means both sides, uncovertebral hypertrophy. This means that's a hypertrophy is where something gets smaller. And they're usually referring to the foramen where the nerve roots exit. Resulting in mild spinal canal stenosis, so in the actual spinal canal. Moderate to severe, severe, right and mild left neural foraminal narrowing. And that's the back of your vertebrae where you got that little bony part that comes out like a shark's fin, and then there's the side vertebrae where the spinal cord goes down this way, and then the nerves come out like this, like the brachial plexus in the neck that fucks up my whole shoulder and leg, all in the arm, not leg. They got some of this right. Never got it right before, but they got it right today. C3, C4, osteophyte complex. C4, C5, moderate to severe, mild left neural foraminal narrowing. A foramen is a hole, and that's how to say hole in your body. These are holes that are supposed to be there, not like the hole in my sacrum, which is spina bifida, that they did not find at all on this report. Just spoiler alert, they didn't find it. It's 2 by 8 inches, about the size of a small skinny model's maxi pad. Yeah, Kate Moss had a maxi pad and it rode up where the bottom of it was like at the crack of her non-existent ass, and then the upper part of it went up to the lumbar spine, and then you drill the hole in the bone, oval shaped like that maxi pad. That's what I got. That's spina bifida, and there's no mention of it anywhere in here. T233, there is central disc protrusion. Protrusion's pretty bad. That means it's sticking all the way out. That's code word. When they say herniation, bulging, protrusion, a protrusion is it's sticking all the way out, and it's usually into the spinal cord, and it is, and I can find it. Without significant spinal canal narrowing or neuroforaminal stenosis. But it is sticking right into my frickin' spinal cord. And I can show that to a 5-year-old on a computer. Literally. At L1, L2, there is mild diffuse disc bulge. Remember, a bulge is more than a herniation, a bulging disc, without significant spinal canal. And they fucked up, I've got most of my thoracic spine where every single disc and bone spur is halfway into my spinal cord. So you got your canal where it floats in, then inside of that is a sac of fluid, and then the spinal cord itself, the bones and the discs are halfway pinching into that cord at most of my levels. L2, L3 level, there is a small posterior annular fissure. That means there's a tear in the disc that goes into the annulus sac, which is in the middle, which is kind of like a sack of jelly that's at the center of all your discs. If you have all your discs, and I don't have most, but I do have this one apparently, maybe, I'll check and see. And that's an annular tear. They're incredibly painful, and that's probably what happened and why there's so much lumbar pain in my spina bifida that they couldn't find. At L4, L5, also another annular fissure is again noted. There is diffuse disc bulge in superimposed central protrusion. That's fancy words for, wow, there's a lot of fucked up shit going on in there, resulting in mild spinal canal stenosis. Yeah, it's mild if you're a moron and you don't see that it's halfway into your spinal cord. There is bilateral facet arthropathy, resulting in mild bilateral neuro. That means that the bones are all swollen and fucked up on both sides, and it's basically squeezing off the nerve roots as they exit out. At L5S1, this is hilarious because that's just a solid piece of knitted bone. There is near complete loss of disc space height. No, there's not. The disc space height was maintained. It's just all a solid piece of bone. The disc is gone, but the height's maintained, literally. It's just bone. My body did a fusion by itself without a doctor cutting me open. And as Andrew Yuan, who probably saved my life God knows how many times, an amazing DO in Southport, said, never get cut unless you're dying. Let Mother Nature do it herself. She'll do a much better job. And she did, resulting in moderate left and mild neurophenomenal stenosis. Moderate is pretty. That's code word for medicine for big. So that's the shit report I got. Again, that finds some stuff, like 20%. I could go through that and line by line and show that. There's some other things I want to tell you about my experience at the ER last night, where I got shit imaging and didn't get the right imaging, and they didn't do my shoulder at all, which is way out of my socket and screaming and honking that they said they were going to do. But then the shift change came on, and the doctor didn't tell the next doctor that, hey, that guy really needs his shoulder image because it's hanging out by 4 inches down and low, and it's all jacked up, and you really need to get that image because he was holding the steering wheel with his right hand when it hit the retaining wall and all that energy went into his shoulder. They fucked that up. They didn't do any imaging because the doctor that came on wasn't told to do that, and they sent me down there. And when I asked them about it, they're like, well, you've already got a messed up shoulder, so it's probably just still messed up. That's literally the answer they gave me. But I did get some nice parting gifts. I do love that the nurse who did my discharge told me that they did all this blood work and whatnot to make sure I was okay, which is really concerning because they gave me some parting gifts surrounding that blood work that they left after they discharged. And I figured, well, if they're not going to use them, I will. I'll just stick them someplace and keep them for a courtroom later. It's my blood work that they left sitting on the table with my name on it that they never tested, that they said they did right here. Woo! They left it all just sitting right there. I'm a little loopy, not from any medications, but from pain and lack of sleep. They didn't give me any medications. They gave me ibuprofen. They wouldn't give me IV Toradol because, we just gave you ibuprofen. If anyone knows my history with ultra-rapid metabolism and polymorphism, that's about as dumb as a box of rocks can get. And I'm literally talking about a box of rocks, not a doctor. Parting gifts, blood work. Maybe I'll send it to a lab and get it done myself and see what the fuck's going on. No, I'm not. But I am going to keep these as a souvenir. And we can show how drastically moronic and ridiculous that hospital is. One last parting gift that I think you'll really enjoy. I know I will. I know that I'll be using it a lot in the future. I'm really glad that they let me go out of the hospital with this one because if I can get intravenous medications that are effective, prescribed, then I can use this and it'll be awesome. It's not a port or anything like that, but it is a goddamn IV stuck in my vein. Still, I'm fucking home. That's my bed. Those are my nasty ass sheets that are stained from pets and maybe it's Wookiee sweat. But yeah, I know how to take these out. It's not a big deal. I'll just, I had a sleeve on because I was freezing because it was cold in there. But yeah, they sent me home with blood in containers and an IV. I'll go yank that out right now. I'm not going to keep it. That's a joke. Let's see how much, if any, of this got recorded. There you go, folks. That's Yale for you in a nutshell. It's a fucking nightmare. House of horrors. I only go there for the good MRIs. I'm too tired to read the disc right now and get it right and then see what the hell is going on in there and how fucked up I am. And then I have to go get a real CT scan, but I'll probably get that at Southbury Imaging. Because they do a fantastic job. I haven't had one report done there yet that wasn't at least 80% accurate, which with the shit I got is fantastic. Even Fraser Henderson is 90% accurate. All right. Toodaloos, folks. I'm going to go play with my blood and my IV. Bye-bye.